Good morning. On behalf of the NC Chamber, welcome to COVID-19 Response and Recovery, legislative update from NC's elected leaders. I am Janelle Boyd with the NC Chamber. All attendees are muted to avoid any distractions during today's presentation. If time permits, we will answer as many questions as possible at the end of the presentation. If you would like to submit a question during the meeting, you may use the question and answer box. Please do not use the chat box. You may upvote the questions you most want answered by clicking on the thumbs up for that question. The questions with the most votes will be answered first. For media in attendance, please identify the organization you represent when you submit a question. The recording of today's webinar will be made available to you via email within 24 hours of the webinar. Now, I would like to introduce Deborah Durr, Director of Government Affairs with the NC Chamber. Deborah?
Thank you, Janelle, and good morning to all of you who have joined us today to engage with some of our legislative leaders who will give us their view of the business climate in their part of the state and a preview of what we can expect will take place tomorrow when the General Assembly convenes. Joining us to discuss those topics and more are Senator Chuck Edwards from Senate District 48, Buncombe County, Henderson County, and Transylvania counties, Senator Paul Newton from Senate District 36, representing Cabarrus and Union counties, Representative Pat McElraft from House District 13, that's Carteret and Jones counties, and Representative Michael Wray from House District 27, that's Halifax and Northampton counties. Thank you guys for joining us today. You know, when I was thinking about what we're going to discuss today, I really hate that we have to have this discussion based on the pandemic and how it has stymied our economy, our lives, and our behavior. But we're here today nonetheless. So what I thought we could do first is for you each to take a couple of minutes and paint a picture for us to let us know what's happening back in your districts when it comes to the business climate, and give us the highs and the lows. We'll start with you, Representative McElraft.
Okay, I think I'm unmuted now.
You are.
Thank you to the Chamber for having this. It's very important that we all reach out to each other and you know, see how each area of our state is doing. And I just wanted to start off by saying, thank goodness we financially at the state, I think, are prepared for this. It's going to take every bit of our rainy day fund, but we are better off, I think, than other states. That's what I'd like to begin to say with. To say in the beginning, and thank goodness for that we had that healthy fund for rainy days. And this is certainly a rainy day after we've had 2 other hurricanes lately, or 4 other hurricanes lately. I represent District 13, which is Jones County, which is a farming focused county, and Carteret County, which is a tourism focused county. And I'm going to concentrate on the tourism impact of COVID-19, but I'd just like to say Jones County also, you know, got hit by all the hurricanes. The farmers lost their crops. Those kind of things have already affected them. Many people flooded, lost their jobs, and lost their homes. And now they're losing their jobs. A lot of them work in Kinston and other places. They have a few small businesses there, mostly drive-through restaurants. So a lot of those are still open, which is a good thing. But of course their school, they have a brand new school there that has internet, but most of the children in Jones County don't have internet. So broadband really comes to the forefront for Jones County in this COVID-19 pandemic. In Carteret County, our top 3 drivers of the economy are number 1, tourism, number 2, tourism, number 3, tourism. Most of our, if not all of our smaller businesses, restaurants, boat sales, boutiques, carpet and tile shops, those kind of things. They all depend on tourism, a tourism economy. So we're very blessed to have our tourists. And this year, our tourists have not been able to come to the beach. So that's been very hard. Emerald Isle alone goes from 3,200 residents to 50,000 visitors in each week of the summer. So it's a huge impact to all of our little shops and our restaurants and all, as I've said. Our restaurants were the first to be affected, of course, as they were all over the state. When we first told them they could move outside, and they did that. Then they were spacing too close together even outside, so then they moved them to where they were only carry out or delivery. So they've had to adapt to this whole thing, and a lot of them have tried to stay in business through the PPP plan. The only problem is I have found out that so many of them have applied, but of course the funds ran out of the small business programs, federal funds. So there's this new influx of money. Maybe that'll help with those who have filed for those federal programs, loans. Besides the restaurants, we have our hotels and all that were really, really hard hit. Now, all of those can participate in the PPP, even though it's hard. We don't have the money in that program yet reestablished. But a group of people who are really going to be suffering because they don't have loss of rent insurance. It doesn't cover this because of the pandemic exclusion. They don't have business loss, or the homeowners here. Our homeowners, beach house homeowners, are just like hotel folks, except they don't qualify for PPP because they don't have employees. So they are going to be losing all the rents if we don't get our tourists back, and have lost rents. And there's no federal program for them. So a lot of them are having a hard time paying their mortgage, and they may lose their homes because of it. So that's a group of people I wanted to really focus on too, that are really, I think, being ignored as far as the impact of COVID-19. Of course, if we don't have our tourists, we don't have our head boats, our recreational fishing industry, commercial fishing industry has been impacted hugely because it is, it depends on restaurants wanting fish. And of course they all want them, but a lot of it can't be in the takeout market. So since there's no market for fresh fish, our commercial fishermen are having a hard time too, as are our head boat captains and those who take people out for recreational fishing. So that's a big industry. Our other industry that is being impacted is our hospital. It's our number one employer in Carteret County, individual employer is our hospital. And because they have not been able to do elective surgeries, it's really costing them, a lot of money they've lost a lot of money in this because they're trying to keep their employees on, but when you don't have your elective surgeries. And right now, Carteret County has 29 COVID positive, and almost all of them have recovered. Just a few have not recovered. And we had 3 deaths, and they were in their 80s and 90s. So we've been very lucky here. 1 death is too many, but compared to the rest of the state and other states like New York, we've been very lucky when it goes to the health of our folks. We also have Cherry Point. A lot of folks have jobs at Cherry Point, and Cherry Point is continuing on. They had to cancel their air show, but they're still completing their mission. They said we did our Don Kirkman, our economic developer, and I know you're on here, Don. He's done a great job, and he reached out to the air station to find out if they had any issues that we needed to discuss. So dental offices, doctors' offices, they're all, because it's only essential things that are having to go in dentist offices are having to buy more PPE than they've ever had to. So it's really cut into their business and their profits also. So the only other thing I might discuss too, third, is our, we have our local governments that are really suffering from this. Our sales tax and our occupancy tax are what pay for the beach towns nourishing the beaches. If we don't keep healthy beaches, then the tourists don't come. So there's really going to be an impact on sales and occupancy tax. But you know, we've been affected by Hurricane Florence, Hurricane Dorian, and now Hurricane COVID-19, Hurricane Corona COVID-19. And we are strong. We will come back from this. But there are a lot of hurting people here.
Thank you, Representative McElraft. And before we go on, I just want you to know that one of your constituents wanted you to know that she thanks you so much for mentioning that PPP does not cover business owners who do not have employees. So you're being heard, and you're being heard clearly. Next. How about you, Representative Wray?
Thank you, Deborah. Pat, it's a pleasure to follow behind you. She's a great colleague from the coast of North Carolina. I'm from Eastern North Carolina. I represent Halifax, Northampton County. We're up to about probably 80 cases ballpark here in Northampton County, a little bit less, give or take. But we're a population of 20,000 people. We have about 50, give or take, in Halifax County, and we're a population of about 52,000 people there. And we're along the I-95 corridor, which has been a main thoroughfare from the north to the south. And we've had a lot of challenges here because we're based on travel and tourism in our community also. But one of the, and this affects all of North Carolina, from Murphy to Manio. And our philosophy here is working together works. We've had some issues, and a lot of issues are very important. And, one of the things about it, when things get tough like this, we need to thank everybody from our people on the front line in the hospitals and nurses and doctors and everybody they are working hard for us. Just like, for example, we've got a distillery in Weldon, North Carolina, that they switched over to making hand sanitizer for our emergency management people. So that was something we were able to work with, and they were having to put it in 5-gallon buckets. And so we were able to partner with McPherson Beverage, one of our local Pepsi distributors here, and they were able to donate water, and we were able to pull the water out and put the hand sanitizer into there. And it's been a pleasure working with the North Carolina Food Bank has been coming to our community. But similar to what Pat said, we thrive on travel and tourism here also. Our restaurants are getting mom and pops to corporate are also hurting. We have a lot of restaurants around the quarter. A lot of them, our local our local travel and tourism and local economic developer, they have partnered to get some data information, what's going on. And so a lot of that's done by cell phones. And so, for example, not saying, particular businesses, because I don't think it's appropriate, but I think our larger food chains they're down like 98%. And so they can't base it on takeout because they're not doing much. But our hotels are down from probably 98% occupancy down to about a 25% occupancy. So, we're struggling just like anybody else. And the biggest thing is just doing constituent services and trying to help our people. And one of the most moving things for me is to be involved on Zoom calls across North Carolina and show the legislators are still working and still caring for the citizens of North Carolina. And we're doing everything we can. And I look forward. I hate we have to come back to Raleigh up under these circumstances, but I'm prepared to do what we have to do. But, the Golden Leaf, it's been a pleasure to work with Representative Jason Sain and Julia Howard and our committee on COVID-19, on economic development stimulus. We're working with Golden Leaf. We've got a bill that has to be approved, but we're working through other counterparts on the Senate side to hopefully reach out where we can give Golden Leaf some more funds to help our small business individuals. And we based it from 50 to up to 100. We know our large businesses are also hurting, but our small businesses are definitely, detrimental to them. And so hopefully tomorrow and this week, we can help out because Golden Leaf has been a champion for all of North Carolina. And out of 98 counties that participated, 90% of them are small business owners, and the average loan's about $35,000 to $36,000. But Golden Leaf has committed $15 million, and tentative, we're going to commit 75 million, and within the bridge loan between the federal government, when people applying for those funds, they can be rejuvenated back into that fund. But I look forward to talking some more. Pat covered a lot of what I was going to talk about, but I'll give the other members some time so we can listen to what everybody else has to say. But thank you.
Thank you, Representative Wray. Senator Newton?
Sure, thank you. So we're the home of the Speedway. I don't need to tell you that they, to this point, cannot run any races, can't have any fans in the stand. There's some optimism that that might change somewhat by the end of May, but we will see. We're the home of Concord Mills. Only 2 stores are allowed to be open in Concord Mills, Bass Pro Shops and Best Buy. So our retailers are hurting. In addition, S&D Coffee and Tea, which is a company that has international contracts located in Concord, North Carolina, has had to furlough a number of employees because of the hospitality industry essentially going away overnight around the world. Some positive stories, though, I want to share. One is Corning in Midland. They are working all shifts, creating fiber optic line. They're hiring people. They are paying employees bonuses to come to work in this uncertain time. And so they're doing quite well. And then the last story I will share relates to a sort of innovation through the crisis. And that comes from a small company called Dough Girls. They're a small food caterer, and they got 90% of their income before the crisis by catering events. As you know, those events have been shut down. So they went to online prepared to order takeout meals. And this is a company that's run, the commercial kitchen is in their backyard. But Dough Girls make 300 meals a day. And I understand that often every one of those meals is sold out online within 15 minutes of the posting of that meal. So she is not only surviving the crisis, but she's making some organizational changes, if you will, that will carry through the crisis and into how she comes out after the crisis. Because yes, she'll start catering events again, but she also may continue to do made to order carry-out meals. So that's a positive story from Cabarrus County. And I do want to quickly thank Barbie Jones, who is our outstanding person on regional director is her title, executive director of our regional chamber. Sorry, Barbie, but thank you for your input and your good ideas surrounding this.
Thank you, Senator Newton. It is so pleasing to hear good stories about how some companies and businesses are pivoting during these times of despair. Senator Edwards.
Yeah, good morning. Can you hear me okay?
Yes.
All right. I'd like to thank the North Carolina Chamber for hosting this event, and I'd like to express my appreciation to all the members for supporting the North Carolina Chamber. Those of us, particularly in business, really count on the Chamber to be an advocate and a voice and help collect information and opinions and make sure that those make it to the Senate Chamber. And I appreciate all of you for that. Just a real quick overview of what's happening in District 48, which is probably much like around the rest of the state. The 3 counties that I represent have all got an incredible downtown presence that attracts tourists. And those downtowns have effectively been decimated. Doors are closed. There's a couple of restaurants here and there that are trying to do some takeout business. They're not very successful at it. And all 3 downtowns are essentially just ghost towns. The small businesses are really crippled. Our hotels and our restaurants are suffering. I consider District 48, particularly around Asheville, as the brewery capital of the world. Those breweries are totally closed. Some are offering takeout growler type services, but they're only doing a fraction of their business. The tourist industry in general, which we count on very much in the mountains, is gone. Nobody's coming here to do zip lines or camping or paddle tours or fishing or many of the events that they normally would visit the mountains for this time of year, because there's no restaurants and bars. And the folks are ordered to stay at home. One of the industries that we're most concerned with here in the mountains is the summer camp industry. I've been told from a number of sources that my Senate District 48 has the highest concentration of summer camps than any Senate district in the United States. And the summer camps are extremely concerned that they could go perhaps 22 months without generating a single dollar income if we can't come up with a plan to get them reopened soon. Hospitals are really suffering. A lot of hospitals in our area have been somewhat fragile anyway, but the order to stop any elective procedures, which is typically their bread and butter, that's how they earn their income, the order to stop that has really crippled hospitals and has given us great concern. Manufacturing, we've got some mixed stories there. Some have just simply had to shut down. Some have slowed production, and then again, some have halted. Some manufacturers have been successful in changing the footprints on their floors so that they could still maintain social distancing while employees continue to work. We have had a great deal of successes in the area too. Like I've heard a couple of other stories, we've got a couple of companies that stick out in particular. Pisgah Labs over near Brevard is a pharmaceutical ingredient company, and they've been able to retool and produce hand sanitizer to fill a void for local companies here. We've got a local company, Aquilabar, which makes pressure regulators for oxygen tanks, compressors, any number of things, but they've been able to redraw their pressure regulator, and they're working to get it quickly incorporated and become a supplier for folks that are out there making these much needed ventilators for COVID-19 patients. One of the other things that I'm really excited to report to you about that's going on in District 48, and that's the effort from our educators, the school superintendents, the principals, the folks in the lunchroom, the teachers assistants, the bus drivers, many volunteers have just put together an incredible effort to keep meals going out daily to kids and families that normally would count on schools being open for meals. And it's really been enlightening for me to follow some of those routes and help deliver meals and recognize just the bond there is between the students and the teachers and the lunchroom folks. The kids, as they approach the bus, are always excited to see their lunchroom ladies handing meals off the back of the bus. The folks on the bus are always excited to see the kids and see them closer to their home environment. It's really been warming to see how folks have come together, and that's a brief overview of what we're seeing here in District 48. Thank you.
Thank you. And let me hold you there for a while. And this question is for everyone, but if Senator Edwards, if you could take the first crack at it, what do you think will be the lasting impacts from this crisis on our state workforce?
There are clearly some businesses that are not going to make it through this. And so I believe that we're going to see a lot of folks in the workforce have to go look for other jobs and develop other skills. And it's unfortunate to say that there are going to be businesses not make it, but let's be real. This is a devastating crisis, and some folks just simply will not survive. And so there's going to be a need for folks to re-educate themselves and develop additional skills. The other thing that I see coming out of this is we will forever change a lot of the policies and procedures that we use to prevent disease from spreading. I see more hand washing sinks and equipment and policies in general that will help prevent the spread of disease. I see restaurants changing forever. A number of the things that they do. Who knows? We may not be shaking hands again at some point in the future. But I believe that just the caution that we will need to exercise in going forward, and how companies set up work areas will change forever.
Senator Newton.
Sure. I think the answer in the vein it was asked really depends on kind of how quickly we open. So there are clearly the near-term effects that we're experiencing today. Medium term, we're definitely going to do things differently. I think longer term, it depends on the development of vaccines. You know, we have a great life science caucus here, in North Carolina, and NC Bio will tell you how many people are working on longer term solutions to the problem we've got. You know, when I think about this whole issue, I think of it in three buckets. One is the sort of the scientific bucket, which has been talked a lot about publicly, and we can talk about it more here. Second is the political bucket, and that's sort of the third rail. People don't want to talk about that, but we probably should have that conversation, even if it's uncomfortable. But the third bucket is the business bucket, which we're touching on now. And I think we ought to all, the businesses that think they can make it through this, ought to be thinking about the example of the small company Doe Girls in Cabarrus County. And for those companies, the question is, or the most important question is not how are we going to get through this? Because they need to get through it. They'll make those decisions. But what changes can we make as a business to be permanently stronger when we emerge? Because I think business models are going to change, and there may be actually success to be found. I do want to caution this audience, though, to a storm cloud that I see forming very quickly on the horizon, and that's the litigation exposure that's being created by the uncertainties associated with the virus, with the shutdown, with the voluntary nature in some respects of how to reopen, when to reopen, employees coming in that may have been infected elsewhere, but they bring that to the workplace. So I think that hindsight's always going to be 20/20. There'll be criticism of companies after the fact. And I think that the people on this call should be having serious conversations with their federal representatives about broadening liability protections. Because as we sit here today, nobody has the answer. No one knows exactly what everyone should be doing. And I don't think that uncertainty should lead to onerous litigation exposure for the business community in the future.
Thank you, sir. Representative Wray, unmute your mic.
If you would repeat the question, please.
The question was, what do you think the impact of this COVID-19 is going to have on the state's workforce?
I mean, we're already seeing that. I think this is worse than September 11th. September 11th was devastating to America. I mean, this is devastating to America also, and especially to North Carolina. I mean, it'll probably be a 2 to 3 year recovery or longer with the situation we're going. And it's going to close a lot of large businesses and small businesses because they just can't survive. I mean, it's not enough. You can't print enough money in Washington, and everybody's in desperation. But togetherness, we'll get through this. I think that the challenges are going to be, it's going to affect the small business person to the large business person. But again, we've got to get the information out there to them as quick as we can. We have been, so they can apply for the funding. Everybody needs to look at their insurance policies, the coverages they have. It's just going to be, and like Senator Edwards said, a lot of people have to transition back. I've heard a situation here. Our local optometrist group has laid off workers, and they've been working in a small facility here. And they're going to make them reapply when they go back to work. I mean, it's just a devastation thing. And of course, people working in our manufacturing facilities. I think the space is going to be something that's going to be a very serious matter. And we can talk about the hand bumps and the elbow bumps and things like that. But really, I think this is a time that America and North Carolina, that the working together works, and working through this solution. It's not going to be an easy thing, and we as elected officials have to lead by example, and we have to listen to our constituents. And one constituent is just as important as 1,000, but 1,000, everybody's important. But I think we've got to listen to all these stories because of people trying to apply for unemployment, and you're in our system. You're prepared for 1,500 to 2,500 people a week, and you got 400,000 or 500,000 in like a 14-day period, and having to upgrade the service. But our hospitals gonna have to, they're heartbeat of our community. If you get sick, where you going? You're going to a doctor or some kind of healthcare facility. So again, we're gonna have to support our small businesses and large businesses, and I think we get through this together. And I think North Carolina Chamber has definitely been a good leader in doing outreach to the communities and listen to what's going on. So again, we're gonna get through this together. Working together works.
Thank you, sir. Representative McElraft.
Thank you very much. Pretty much all has been said about a lot of businesses not being able to survive. And of course, we've got the long-term impact is you need to be prepared for that rainy day. Personally, and I think a lot of our workers are going to start thinking about that too. Instead of buying that extra cup of coffee, they may be putting a little more money in their savings account to last them until their unemployment can kick in. Because our Department of Employment Security has done a phenomenal job of trying to get all these 500, 600,000 folks on unemployment benefits. And go through that process, but it's been very frustrating too. When you can't get a hold of anyone, and they're doing their best, and have Lockhart Taylor's done a phenomenal job. But we are going to have to prepare for these possibilities forever, and we need to prepare. Our hospitals do need to prepare with PPE when we're not in the midst of the viral contamination. We need to be ordering PPE, get it ready. I really appreciate the effort that's been made at the federal level to really stock up on those kinds of things. But another thing besides savings is a lot of, and it's also, just like Chuck said, it's according to when we come back. If we get back soon in our coastal areas with our tourism, then we can, I think, adjust, and we'll still have lots of work for our employees to come back to work. The only thing that scares me is this new program that they have, and it's great for the unemployed, but how many people are going to give up $950 a week when they're working in a restaurant and go back to waiting tables for a lot less money? So the federal program of unemployment, really scares me a little bit about people not wanting to go back to work and staying off the whole summer when we really are going to need them if we open the restaurants back up. And everything else has pretty much been said.
Thank you. Senator Newton, you touched on when you were answering the question about the changing complexion of our workforce as it relates to COVID-19. You touched on reopening. So let's talk about that a little bit. Last week, the governor's executive order 135 extended the stay-at-home order to May 8th, and with 3 phases of reopening. And of course, that's based on testing, tracking, and trends of COVID-19. Let's talk about, among all of you, did you support the initial stay-at-home order? And what is your opinion of where we are today when it comes to reopening North Carolina? Starting with you, Senator Newton.
Thank you. I did support the initial activity or decisions by the governor because there was so much that was unknown. We really did think and fear that the hospitals would be overwhelmed. But for those same reasons that I supported the governor, and I think we, in the main, kind of all did, we do have data, not only from North Carolina, but from around the world, that tells us a different story, that the same reasons we shut down don't still exist with respect to whether we should start up. We know who the vulnerable populations are. We know social distancing, or we believe social distancing is working. There are some studies that say that it really is not making any difference. We've got Sweden, we've got Santa Clara, California, the work that they've done that tell us a lot of information we did not have initially. So while I applaud the governor for laying out a plan, the plan doesn't give the business community or employees enough certainty. I think my personal opinion is we could, based on the data-driven analysis, go right to phase 2, which is still protective, and those who are vulnerable are protected. But we are going to really cause a lot of harm to our North Carolinians, to the business community, by waiting as long as we're waiting to move into that stage 2. So for reasons I can expand on later if we have time, but I think that would be my opinion, that with proper social distancing, proper protective measures, we should start stage 2 of the governor's plan today.
Thank you. Representative Wray.
I haven't supported Governor Cooper's decision because he has had experts working up under him, and I've supported President Trump with what he's had going on with all the expertise. I think the biggest thing is especially here in rural North Carolina. I mean, it's the same thing as urban North Carolina. We're one North Carolina, but I've had coronavirus individuals to call me from the hospital with desperation. What am I going to do when I leave? I don't have any food. Who's going to look after me? I've had a plant manager here in Weldon, North Carolina, that was healthy. His wife was a nurse. He has coronavirus, and just listen to those horror stories. I mean, listening, and he was a healthy gentleman. And I think again, a lot of small businesses. I mean, you go to a grocery store now, you go to Walmart and Lowe's, and some people think it's no big deal, but it's going to be a big deal when your family gets it. We've got to support our businesses, but also we have to support our health care. I think I think it's some discussion that still needs to be continued to talk about. The numbers are still increasing. People can say, well, it's only this amount of numbers. But I believe one life is as important as if you could save one life, you're doing your duty. But I think we're going to have to open back up, and I just think it's going to come to a point when the curve changes and it starts going down. And that's the reason I'm a small business guy. I'm not in the health field, but I'm going to leave it up to the experts. But again, and like Buck said, represent Senator Newton. I mean, it's a hard decision, but I mean, we're going to have to get back. We're going to have to get back opening up because I mean, eventually, and the sooner the better. But when's the better going to be? And I think we're going to have to make this decision together as leaders of North Carolina, and we're going to have to work together and not point fingers. The right day, right time, the wrong time. But it's going to be a long-term, recovery for North Carolina. But again, we're in this together. But I respect the governor. I respect his staff that he has with him, the experts, and I respect our hospital fields. I mean, because those numbers are still coming in. We had one case in Northampton County that I was seeing it on social media, and I was not seeing it through Department of Health and Human Services. And so I had to call, and the reason it wasn't on the Department of Health and Human Services website was because our health director was doing his job. He was on the ground doing tests, and it ended up being a rest home here in Northampton County. There ended up being about 28 patients there, and then of course it went into staff members. So again, I think we need to continue to look daily. I don't think it should be a date that we're going to open back up like tomorrow, but I think May the 8th is a big day, and I think we drastically need to start moving into the next phase. But at least we have a plan. And we can always change that plan. But if we didn't have a plan, it'd be different. But we have a plan. Thank you.
Thank you. Representative McElraft.
Can you hear me there?
Yes.
Okay. I was fine with what the governor did. I really was. And I think that most of our folks were too. because they were scared. They had seen what was happening in New York and in Louisiana and other places, and it really frightened them, this virus and the unknown. When I look at the state, we see pockets of where they have higher hospitalizations, and we do realize now a lot of it's in the congregate living areas, the nursing homes, et cetera. And we need to better protect those and have more PPE there, things like that. And I think that's something for the future we'll be looking at. But right now, there are counties that have actually no positives. There are counties that have very few positives.
Representative McElraft, I think you inadvertently muted your, okay.
Oh.
So you were saying that if you would pick up where those counties that have no cases and some with few cases.
Yes, thank you, Deborah. So I would like to see kind of what's happening at the federal level, a little leeway given to the counties to where we could make the decision at the county level as to whether it's time for us to open our areas back up. I understand Mecklenburg, Wake, the Greensboro area, all where we have really higher concentrations of positives. I'd really like to see the governor give consideration to opening up those that have very few positives. And that's what I'm hoping he will do.
Senator Edwards.
Yeah, hi, thank you for the question. I'm going to answer that in two parts. I did support the decision because the governor is the authority in the position to make that decision, but I didn't agree with it. I feel like it was an overreaction, but I certainly support it because I support the authority and the Constitution of North Carolina. As far as reopening, we're way past time for a plan, and the three phases that I saw come out of the governor's office last week don't offer any certainty to businesses. In my opinion, it says on May 8th, we're going to do things the way that we've been doing them previously, and in a couple of weeks, we'll consider changing it. And a couple of weeks after that, we'll consider changing it again. Businesses in North Carolina need some certainty right now. We need a plan to reopen. We've got to get folks back to work. The sooner, the better. We have learned a lot through this process and put a lot of precautions in place that we should certainly exercise as we reopen. And we should warn the folks that are more susceptible to getting sick with COVID-19 of the risks and encourage them to take additional precautions. But we're past the time that we need to be reopening.
Thank you, sir. And reopening is what's going to happen tomorrow down at the General Assembly as you all come back to Raleigh for this COVID-19 special legislative session. And while the governor has already laid out his budget priorities, what will be some of your budget priorities? And what I'm trying to do is integrate some of the questions that we're now getting from our audience. And one that tops the list is DOT funding. The governor has in his budget for money from the federal government, the $300 million for DOT. While you discuss some of your budget priorities, will you also address DOT funding? And we will start with you, Representative Wray.
I think that's definitely one of the on the top. I mean, it's not the top thing, but it's one of them in the top 5. Everybody knows that people are not traveling now, so everybody sees the fuel prices dropping, and which that means gas tax is not being put into the coffers. So that's definitely something we have to consider and look at. And DOT is looking at laying off individuals temporary. We're getting ready to the summertime when a lot of contracts and a lot of work is done. It's definitely something we're going to have to definitely going to be one of the top 5 priorities. And of course, another one of the things that I'll skirt along and then I'll pass along. But broadband is really going to be very, very important in this legislation during this this coronavirus session, I think, because You know, we're putting mandates on individuals from businesses. We're putting mandates on our school teachers and our students and people graduating from college online. And, you know, we still have a lot of pockets in North Carolina that we do not have broadband. So I think that's going to be a top product, you know, also. So thank you.
Thank you. Representative McElrath.
Thank you, Deborah. We've been working on the House side on COVID-19 working groups, and one was the economy, one was education, one was looking at permits and things like that, putting things off that didn't have to be done with the DOV, allowing people some flexibility on those kinds of things, you know, permit increases and increase the date of your expirations, things like that. So that was that committee's work. So we have bills that are ready to go on the House side, and I know the Senate's been working hard too. We want to address the COVID-19 things right away. But of course, we know as far as the budget goes, we're not going to have any numbers really until after we start getting the revenue numbers in July. So as far as big budget things, thank goodness we do have the rainy day fund, because if we didn't have those billions of dollars in that, this state would be just where New York is right now, I think, asking the federal government to bail us out, or where Illinois is trying to get them to take care of their unfunded pension plans. So we are in good shape. There's not going to be that extra money that we had anticipated spending with all the revenues that were coming in. We were in great economic shape, just like the federal government was before COVID-19 hit. So we will work hard for the things that are necessary, but there are going to be some hard decisions to be made with the budget because of the lack of funding with the revenue and sales tax and all that are not coming in.
Thank you. Senator Edwards.
Yeah, thanks. I know that DOT is important. I'm not sure that that is at the top of my list of things that I think we need to tackle when we get to Raleigh tomorrow. We did get a $2 billion appropriation from the federal government. I believe that our challenge is going to be how can we most effectively provide relief and fill budget gaps that have been created by the crisis with that $2 billion, being careful to not spend it all because we don't know yet what all of the needs are going to be. The key areas that I see that we're going to have to focus on are in the area of education. We've got to supplement the school lunch program and breakfasts that have been going out. There's cleaning, sanitizing needs to be done. There's equipment that needs to be purchased. In the area of healthcare, we've got to take a close look at the hospitals and try to figure out how to prop them up or support them where we can because of the decision that the governor made to eliminate elective surgeries. We're going to have some new Medicaid dollars as a result of the federal program that came down that we're going to have to find. In the area of commerce, I've been working with a work group trying to figure out how we can restart the tourism industry because there's so much in North Carolina that's dependent on tourism. And then we're going to have to look at things like waiving interest on deferred income taxes. You know, the federal government deferred income taxes. The state decided to defer income taxes. It'll take legislation to waive those taxes. And then I think Representative McElraft adequately pointed out that there's so much that we won't know until later in the summer when we get our final projections on revenue. But those are the things I see as the priority in terms of budget.
Thank you. Senator Newton.
Sure. Thank you. Those are all great comments. And the thing I would add to that is that I think the public would be pleased to know how hard both sides of the aisle have been working together to create a consensus COVID-19 relief package. And so we've had hundreds of ideas from both sides of the aisle coming together. Senators Blue and Berger are working with staff to pull those good ideas together. And I think what our goal is to have a consensus bill. It's sort of a laser-like bill. Now, we will have to come back. We will have to come back even before the budget items, probably. I mean, for example, the $2 billion coming from the federal government, we've got to now budget that at a state level. If more money comes in, we'll need to get back there and get that money to work as well. So I agree with all that. I do want to comment on Representative Wray's point about Golden Leaf. Absolutely. I mean, I think that is something we are going to do. It's just a question of at what level. And we're going to do everything we can to help the small businesses that may have missed out with the federal funding.
Well, I can tell you that you and your colleagues, in my opinion, are in an unenviable position given the state of affairs with this COVID-19 and the needs that you will have to address starting tomorrow. And as all you acknowledged, it's going to be a very arduous task, I think, to say the least. So having said that, and it seems that we have about 9 minutes, and we've talked about the budget priorities, but for you individually, give us perhaps your top 3 policy issues that you would like to see addressed as you move forward at the legislature starting tomorrow. And I believe it's back to you, Representative McElraft, to answer the question first.
Am I good?
Yes, you are.
Technology, not my
So
thing.
much fun.
Well, of course, a priority for me in this area and for my constituents would be to try to figure out ways to get our tourists back, our tourist economy all over the state, not just for the coast, but it's just like Chairman Wray said just a few minutes ago, that even Halifax County and all, they're a tourist county. So I think North Carolina, the number 3 industry in our state is tourism. So that is a priority, to make sure we can do things like maybe some tourism advertising, some other things that we can help get those tourists to come back to North Carolina. Another priority would be to make sure our hospitals are stable. They really do need some help because we have not given them the authority to have elective surgeries and things like that. And the other priority at the top would be education. We need to make sure that we're prepared for this again, for the online classes that these children are going to have if it ever happens again. I think this has been a big awakening for all of us, the COVID-19 issue, and how we need to prepare better. But I just again say thank you that we had such a wonderful, robust rainy day fund, because we've been hit hard in the past decade with all the hurricanes and now with this COVID-19. And we have that fund has come to the rescue of the state of North Carolina. And we're hoping that with the federal money and what we have saved, that we'll be able to stay the state that we were and come back as a very strong economic leader in the nation.
Thank you. Senator Edwards.
There, I think I got it. I would say that the top priorities for the session this week are going to be to help small businesses, to find a way to help small businesses that can't take advantage of the CARES Act and the PPL program, because that clearly is not an answer for everyone. I expect that we're going to leverage Golden Leaf in order to be able to do that. And then we've got to restart the tourist industry in North Carolina, because there's so much dependent on the tourism industry. I could go on and talk about education and healthcare too, because there's some important things there. But helping our small businesses get restarted, helping tourists, or helping generate the tourist industry, regenerate the tourist industry, are right at the top of the list for me.
Senator Newton.
Thank you. I agree with all those. Two more I would highlight. One is, I think we need to continue shining a light on the safety net government appropriately provides those who are unemployed. They didn't lose their jobs. Government took their jobs as they tried to deal with this pandemic. So they're looking for a safety net. And, you know, I'm hearing numbers like only a third of those who have applied have actually gotten their unemployment payments. And this is no knock on Lockhart Taylor. He's doing the very best he can. And it gets in a little bit in the political realm, but we should as a state have been better prepared to help people who were going to be hurting when we started shutting down their businesses. So I think we're going to continue to shine a light on that. I'm not sure it'll take the form of legislation beyond what we've already heard. I agree, the small business relief with Golden Leaf. But the last thing I would add is I would like us to be creative about ways to position North Carolina to be number one in the nation after companies start building again. I want North Carolina to be the place that job creators choose first coming out of this pandemic, in which to restore and build their businesses. What that looks like takes a number of forms, but I look forward to North Carolina, positioning North Carolina to thrive when we get through this.
Thank you, Senator Newton, and someone gave you an amen to your response. Representative Wray.
Well, thank you, Deborah, and thank you for the NC Chamber for giving us the opportunity to be panelists today. Everyone knows that healthcare is going to be one of the top three priorities. You know, that's something that we're not going to be able to overlook ever for healthcare issues. Get our hospitals back where people can go and have their collective surgeries and be able to continue to thrive. Our schools are a big thing, K through 12. Also, our community colleges and our universities. We're getting ready to go into summer school. We're going to be getting ready to go back to the fall. We've definitely got to, be on top of our educational issues. And of course, everybody knows that main thing is it takes money to make the world go around, and it takes businesses and families to thrive. And our churches are suffering now, and our small businesses are suffering. And so, we've got to help our small businesses, our larger businesses, because everybody working together works, and we're not traveling tourism. So, we can't do this. We can sit here on a panel and say, they're our top three things. But again, like the rest of our panelists, we all know that, we have to work across partisan line, in which we've done that through this issue. And my commitment to my counterparts and to the citizens of North Carolina and to North Carolina Chamber, to the business people, I'm ready to put all hands on deck when we get back to Raleigh and work together and do the best we can to give all our people the opportunity, the ones that's going to have to be retooled and the ones that get them back as soon as we need to get them back to work and safely. But again, thank you, NC Chamber, for what you do and the leadership you and the chambers do across North Carolina.
Thank you, Representative Wray. I think everyone on the webinar had an opportunity to answer that question, if I'm correct. We have only about 2 more minutes, and I would really like to get this question in. Unfortunately, only one of you, I believe, will be able to answer this question within the time frame that we have. The question that we have gotten from the audience is, as we come out of COVID-19 restrictions, will the state be involved in setting new standard operating procedures for businesses to operate? And if so, will you base those new SOPs on science and data?
So I'm a low regulation guy. I'm not in the business of creating new regulations for businesses. If we do that, it will be, I think, to ratchet back restrictions that people perceive are there that are hurting them from being able to really achieve what they need to achieve. But if we do that, yes, the second part of that question, it would be based on data and safety and health care concerns all the way.
Great, thank you so much. And thank each and every one of you for taking time out of what we know to be a very busy day that you have. And we look forward to hearing from you tomorrow and working with you in the future. And thank everyone who took out time today. You can have so many other things that you could be doing someplace else, but you opted to be with us today. We greatly appreciate you being with us. And we look forward to seeing you guys at the legislature and hearing from you all who joined us on the webinar with your comments and more of your questions. Now I will turn it over to Janelle as we close out.
Thank you, Deborah. Thank you all for attending today's presentation on COVID-19 response and recovery, legislative update from NC's elected leaders. We hope you found today's content valuable. You will receive a brief survey of the webinar via email. We would appreciate any feedback you can provide to allow us to improve these sessions. Again, the recording of today's webinar will be made available to you via email within 24 hours of the webinar. Thank you all. Stay safe and healthy during this time. Have a great day.